The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to today's webinar. We're going to have a discussion around optimizing your practice with the American Heart Association. We have multiple presenters and a very full agenda today. Myself, Jeannie Luciano, Debbie Murphy, Anna Taylor, Drew Patel, and Rebecca Alicki will be presenting. Just a quick disclaimer, the recommendations and opinions presented by our guest speakers are not representative of the official position of the American Heart Association. The materials are for educational purposes only and do not constitute an endorsement or instruction by the AHA, and we don't endorse any product or device. Just some housekeeping before we get started. My name is Jeannie Luciano. I'm the Senior Manager for Stroke with the American Heart Association. I'd like to go over a few of these items. So a recording is in progress with all attendees in listen-only mode. The slide deck will be available in the handout section during the presentation and will be sent out with the recording after the webinar. A link to the recording will be emailed following today's presentation. If you experience any technical difficulties, try refreshing your browser, logging out and back in. If these steps don't correct the problem, please contact the GoToWebinar or customer service number that was on your confirmation email. Questions for today's question and answer session following the presentations can be entered at any time into the questions chat box, and we will be answering questions at the end as time allows. Closed captioning is available, so if you require closed captioning, look for the CC on your screen. Just a quick disclaimer for my part. So today's presentation is really just a sampling of some of the American Heart Association and American Stroke Association resources. There are many, many additional resources and contacts for valuable information available on heart.org website. And always feel free to reach out to your quality consultant if you require additional information. This is our esteemed panel here, our wonderful colleagues from the AHA. So just briefly, I'm going to tell you about Get With The Guidelines is a proven in-hospital approach to improving hospital patient outcomes across cardiovascular and stroke-focused areas. Each Get With The Guidelines program promotes a consistent adherence to the latest research-driven guidelines and measurement while providing data and information to professionals for continued improvement in patient care. When your hospital or your health system participates in a Get With The Guidelines program, it can really impact and improve outcomes across the board. It can improve patient outcomes. Following evidence-based guidelines really decreases secondary events and saves lives in your community. It can provide equitable patient care with consistent evidence-based treatments, assure fewer variations due to bias. It can actually improve staff morale when measured goals can generate some friendly competition and deliver positive reasons to celebrate. It can support your certification opportunities. Programs provide a, sorry, that went back. Programs provide a data foundation for simplified hospital certification process through the Joint Commission and other certifying bodies. And it can help with accurate reimbursement and can ensure your hospital is receiving proper reimbursement by recording accurate and improved metrics. It can look at your return on investment, and it actually can provide a competitive edge for recognition, awards, and certification, which are powerful ways for your hospitals to differentiate in their markets and gain attention in your community. So that's just a quick blurb on our Get With The Guidelines program, which I know most of you are familiar with. I am going to hand off to my colleague, Debbie Murphy, to talk to you about some of the certified professional American Heart Association resources. So Debbie, the floor is yours.
Thank you, Jeannie. Hi, everyone. My role at the American Heart Association is as certification program consultant. And I'm going to be speaking today about two professional certifications, telehealth and telestroke, and one facility certification, the Skilled Nursing Facility Stroke Rehabilitation Certification. Okay, this is just a quick reminder of how the American Heart Association certifications, no matter which one it may be, really looks at all of the research, the evidence, and provides us with gold standards and best practices to implement in our areas where we work, really with the goal being standardization of care for our patients. The AHA seal is a seal that's known to everyone, and it demonstrates the AHA work behind all of the knowledge and evidence, no matter where anyone works, no matter what state, what country, that logo is and seal is noted. The certifications, they really also connect our certified professionals and health systems to the most relevant, up-to-date information that continually impacts our practice and care for our patients. So the patient is the center of care, truly the center of care for telehealth and telestroke certifications. They're the forefront. These certifications are the forefront of modern healthcare, revolutionizing the way medical services are delivered. By leveraging the most up-to-date technology, these certifications ensure that patients continue to receive and improve timely, efficient, and specialized care, regardless of their geographic location. And this is being, the telehealth program, which has a broad range of different utilization. And then we have the telestroke, which really focuses on those emergent stroke situations. So we get this question often: why should I obtain a telehealth and or telestroke certification? And this really comes down to an individual making the decision for themselves. You have to do a self-assessment as to what this is going to mean to you professionally, for your patients, and for your area where you provide care. I'm not going to read this whole slide, but I really did want you to have this information. On the left side is a checklist. And this is a checklist you could go down and say, well, my current status in my professional career is I know this, and this. Why should I get certified? And then if you look at the right hand, there's a lot of opportunity, as a certified professional to expand your professional knowledge, increase your confidence, and validate your skills as an expertise in the area, of where you work. You can help improve patient outcomes by helping to standardize care, making safety the core component, providing standardized telehealth and telestroke education and training. There's always areas to learn and be creative, expanding networking opportunities between telehealth and telestroke colleagues and institutions, and also increasing support and access, for resources for our patients, for our colleagues, and ourselves. So continued benefits for our patients. The list is ongoing. And just to go through these really quickly because they're important: increased accessibility to care, expertise in standardized care for areas that don't have those resources, convenience and flexibility for patients, enhanced cost effectiveness, enhanced quality of care, seamless continuity of care, reduced hospital admissions, efficient utilization of resources, patient empowerment, engagement, and enhancing the patient experience, and adaptability to changing needs of our patients and providers. So telehealth and telestroke really have pertain to all of this. Telehealth stroke has that additional disease-specific focus of those patients who need a rapid response to an emergent stroke. There's benefits to healthcare professionals by becoming telehealth and telestroke certified also. It validates expertise in practice, credibility. It increases opportunity for job satisfaction and possible advancement in career, can lead to better patient outcomes. There's ongoing access and updates to the resources of the American Heart Association. And again, networking between your health system and other healthcare systems is priceless. Additional benefits for healthcare professionals. This is one of my favorite slides because no matter where you are in your career, no matter whether you're thinking about starting a program, thinking about implementing, or you have a program and you want to enhance it, there's always more to learn. These certifications provide you with enhanced knowledge about virtual telehealth and telestroke platforms, really describe the expansion of role responsibilities for one that you are currently in, increases a lot of partnerships and collaborations among your healthcare teams, but also the teams outside of your, hospital, talking about for example, your hub and spoke colleagues. And also, being the educator and helping with educations about the telestroke or telehealth practice guidelines, responsibilities, assessments, workflows, etc. So no matter where you are entering this, there's always something to learn and to be beneficial for our patients. And actually, I'm so sorry that I skipped back on that one. Let me see if I could get back. But that actually, thank you so much. So this slide really talks about the benefits of our healthcare system, improving these certifications really help improve patient access and outcomes through integration and expansion of telehealth and telestroke delivery. There's streamlined care and coordination, better communication amongst providers, and there's demonstration of quality care through the measurable patient outcomes. This previous slide that just passed you, that is for your reference. There's 3 articles there on telehealth and telestroke. The links are there for you to, access at any time, but it really shows taking the evidence and putting it into practice. So next I'm going to talk about our skilled nursing facility stroke rehabilitation certification. And I want to thank my colleague Tawny Jackson for these slides. So this is an interesting certification, and actually there are 5 types of facility certifications: the skilled nursing facility for heart failure and stroke rehab, home health and for heart failure, palliative hospice for heart failure, and assisted living facility and healthy senior living. This guideline from AHA, the guidelines for adult stroke rehabilitation and recovery, are actually the framework and structure for how the certification for this skilled nursing facility for stroke rehab was developed. So there is also a link on this guideline for you to read it for more information. But it really provides the standards, guidelines, etc. Some certifications that are required by the skilled facility are very similar if you are familiar with all the components required for stroke program certification. Looking at these components here: program management, really starting out what's your mission, vision, values, scope of practice, infrastructure of your program. Personal education, making sure that your staff is well trained and educated to care for stroke patients. Patient and caregiver education, this noting that all education for patients must be individualized, and it also should support caregivers. Care coordination should be seamless and streamlined, and this goes to say, for example, if the patient's in the hospital and they're being discharged to a skilled facility, the goal is seamless transition from hospital to skilled facility, and then the goal for that patient's to go home. So there be a seamless transition of care also to the home. Clinical management really focuses on the care of the patient while they're in the hospital, and this looks at the adherence to clinical practice guidelines, pathways, order sets, etc. And then performance improvement, which really involves looking at how are we taking care of our patients and what do our outcomes look like. These are the metrics for this skilled nursing facility stroke rehab certification. I'm not going to read each one of these, but if you do take a glance at these actually do model a stroke program certification program. These are 3 more metrics here: discharges from the program, average length of stay, and discharge disposition. All of these metrics are reported from the skilled facility to AHA on a quarterly basis, and always monitoring for compliance and always looking, it's nice to collect the data, but how can we do better? So help spread the word about our certifications and improving our patient care. And if anyone has any questions about certifications, there is a link on here, certification@heart.org. So I thank you for listening to my presentation, and I'm going to transfer this over to Anna.
Thank you, Debbie.
You're welcome.
See here. Okay. Thank you for the opportunity today to highlight some of the services and tools for survivors of stroke, caregivers, family members, and stroke support group leaders. My name is Anna Taylor, and I'm the National Senior Program Lead for the American Stroke Association. Our mission is to be a relentless force for a world of longer, healthier lives and fewer strokes. And our goal is to provide help and support to anyone affected by stroke. So we realize that each person's stroke and recovery is unique. So our resources reflect that. The Stroke Family Warm Line is managed by our National Engagement Center and connects stroke survivors, their families, and caregivers with a trained stroke specialist. Our specialists stay up to date on what we do, what we offer. We're to find anything that is stroke related on our website. They provide support, helpful information, even help callers connect to local services. And when the need arises, they can just serve as a listening ear as well. There is a dedicated phone number, and these services are offered between Monday and Friday from 8:30 a.m. to 5 p.m. Central Time. Next is our stroke support group finder tool. So support groups are a source of new friends. They are a support. They provide help, encouragement, empowerment, information, resources. And they are a lifeline for survivors of stroke and their caregivers. As an organization, we actually don't lead any stroke support groups, but what we do provide is a registry. A registration of a group with the American Stroke Association ensures the inclusion of that registered group in our search tool. The search feature includes two simple steps. We ask for a zip code and a radius. As the parameters for searching, those looking for a group can select a 5, 10, 20, or a 50-mile radius. And once they enter that information, a list is returned, and you see that at the bottom right-hand corner of the slide. And that list will include any group that fits the criteria they've selected. It will also let someone know if there is a virtual option available, and it will be marked as a yes. And you learn more about each of the groups that are listed by clicking on the name of each of the groups. And what then is displayed is a map, the actual address, the time and location, also who the contact person is if they wanted to reach out and had any questions prior to attending. All the links will be linked for you in the presentation, so accessing this will be just at your fingertips as well. Our Heart and Stroke Helper app is a free self-assessment app for survivors of stroke or their caregivers. When the app is downloaded, it offers 4 different health journeys, with stroke being one of them. Once a profile is created, patients can better manage their health, such as track progress on lifestyle habits, health numbers, things like blood pressure, manage their medication, and access stroke resources, information and resources. We have developed a short demonstration video on how to get started, and also a printable flyer, which can be posted or handed out to patients. And you actually will find that under your handouts. today as well. Another great feature of this app is that a hospital or facility can register, and then you become listed in the app. And any patient receiving care at your facility then can select your healthcare system as their care provider. Again, this is linked for you under Register Your Hospital if you don't participate currently or are interested to do so in the future. Our FAST experience utilizes edutainment, so taking education with the goal of making learning enjoyable. So this is an interactive experience to learn the warning signs of a stroke. It uses smartphone or other devices that will simulate what symptoms can look, feel, or sound like. Some of the activities include taking a selfie to demonstrate an even smile, recording a short sentence, and hearing and return a slurred version of that sentence to demonstrate speech. There are also games, there are short quizzes, and short videos. What's exciting is that this experience is available in English and in Spanish, and the Spanish version uses the acronym Rapido. Support for stroke support group leaders. Group leaders are a lifeline and invaluable source of information for survivors of stroke and their caregivers as they navigate the trying times after stroke. Over the years, the last few years, I should say, we have been working on ways that we can support group leaders. One of the ways we have done so is by creating lesson modules. These are fully developed post-stroke related topics, perfect for a group meeting. They are based on guidelines, latest science, best practices. Each of the fully developed topics includes a presentation with discussion question, short videos, and any kind of supporting handouts. And the way the materials have been developed, they are just, complement each other and build on the knowledge and the information that is being provided. So we have a variety of topics available for you. The other way is starting a stroke support groups, or ultimately maybe even bringing life back to an existing one, or making it more robust than it currently is. This can be, seem like a daunting task, but we are here for you, and we, to help. We have actually a webinar from about a year ago that kind of, you can use that as a resource as well. That includes information on how to get started, how to, and different, examples of groups and how they've started their groups and what they offer as a group. We also have a guide and and other resources. So those are linked for you here as well. In your handouts, you can find a stroke support services flyer as well that will help to inform your patients on how the American Stroke Association can support them through our website, through the warm line, and through virtual support group network as well. And then lastly, our Together to End Stroke newsletter. If you already don't subscribe to it, I invite you to do so to get the latest stroke research and consumer education. You truly will be the first one to know about any new resources or patient materials that we are rolling out, as well as resources for you as a healthcare professional. This is a monthly newsletter, so just one email, and typically it's on the first Tuesday of every month, unless it's a holiday. And I think that ends my slides, so thank you.
Thank you, Anna. We're going to now hand off to Dhruv Patel. Dhruv, the floor is yours.
Hello, everyone. So I am Drew Patel. I am the account manager for the Stroke Council. So I help manage the Stroke Council along with Ann Leonard. She wasn't able to make it, but she is great. I recommend if you are interested in the science I'm going to talk about that the Stroke Council works on, I recommend reaching out to her. She's very helpful in helping our volunteers connect with other people and, helping them achieve what they want. So I'm going to talk about the professional membership, the benefits of being a part of the Stroke Council, being a professional member in general. So firstly, we provide $150 million annually of funding and grants to our volunteers, along with access to 14 scientific journals. In the professional membership sphere, there are 16 councils, which the Stroke Council being among the largest. You also get access to hundreds of accredited CE courses online, and each council gives a array of travel grants and awards to its volunteers. The Stroke Council itself last year gave over 20 travel grants to volunteers within the Stroke Council who attended ISC. Along with that, there's plenty of leaders in the field that are part of the Stroke Council that you get an opportunity to meet and collaborate with. Also, you get an opportunity to earn FAHA credentials, which has helped many of our volunteers advance their career. The FAHA eligibility is on the PhD website, which is linked here in the PowerPoint slide set. There's also opportunities for our early career and FIT members. There's our FIT account manager, Stephanie Chung. She has been working on creating a more streamlined FIT program. Additionally, on the PhD website, there is a mentoring platform that we're working to revamp to make more seamless for our volunteers, not only for our volunteers who are mentors, but also the mentees to reach out to each other. For the Stroke Council in general, the Stroke Council has 12 to 16 committees, 6 of which are admin committees. The administrative committees are the ones I manage, and what they do is they host webinars, they nominate for awards, and they have various programming at ISC. So one of the committees that I manage that I would like to highlight is the Stroke Early Career Committee under the leadership of Dr. Alexis Simpkins. We've had a very productive year. In fact, for this month, during Stroke Month, we've had a series of webinars for professional and career development for our volunteers. We've already had 3, and we have 3 more left, which I've included also in the slide set. I'll go over them briefly in a second. We also had programming at ISC for our early career members. This year, we had a session which was called Leveraging Large Data Sets for Stroke Early Career Research members. The next committee that's listed there is a Stroke Membership Committee. So what this committee does is help identify ways that the Stroke Council can target other specialties that may be interested in joining AHE or AHA, or what kind of engagement opportunities do we have as the Stroke Council to engage our volunteers. And then the Stroke Communication Committee, that mainly manages our social media, how to get our content out to our volunteers. That's what the Stroke Communication Committee does. And then the Stroke Nominating Committee, it helps with nominating individuals to volunteer on our council committees, the AHA awards, the travel grants, which are mainly based on abstract submissions. So they view the abstract submissions, they go over abstracts and help nominate for those awards. And they also nominate for our national committees as well. And then finally, the Stroke Leadership Committee, which is an accumulation of individuals that are on these various committees, and they meet biannually to review the status of the status quo of the Stroke Council. What are we planning in the future? What have we done in the past that worked, etc. And then this is one of the Stroke Council Early Career Committee webinars that we have. We actually have it today in a couple of hours. And then the title is Beyond Metrics, Purpose and Practice as a Stroke Center Director. So it's going over the responsibilities of a Stroke Center Director. The next webinar we have is Friday, May 23rd, and this is titled How to Be a Good Mentor and Mentee. And then finally, our last webinar of the month is Thursday, May 29th, and it's called Developing Successful Research Collaboration as an Early Career Researcher. The next part of the Stroke Council that I'd like to talk about is our Stroke Science Committees. Like I said, these are managed mainly by Ann Leonard. So these are the list of the Stroke Council Science Committees. We have the Brain Health Committee, Emergency Neurovascular Care Committee, the Stroke Neurovascular Surgical Intervention Committee, the Stroke Neurocritical Care Committee, the Stroke Psychological Health and Wellbeing Committee, the Stroke Rehabilitation and Recovery Committee, SKILL, and Professional Education Committee. So what some of these committees do, they help develop scientific statements. They work on guidelines. So usually volunteers on these committees, they come up with ideas, come up with gaps in literature, and they help create scientific statements. Some of them on the scientific statements, some of them are from the volunteers from the committee, but they don't necessarily have to be. In specific, the Stroke Professional Education Committee, it develops slide sets for all the Stroke Council scientific statements, and these slide sets are disseminated during the Science News rollout of the scientific statement, and some of these slides can be used for training and education. They can also be used for grant rounds. Another aspect of a valuable resource for our volunteers is the AHA Professional Education or the Lifelong Learning Platform. This is a robust website for professional education. It includes some of the webinars. All of those webinars will be recorded and they'll be on this platform later for viewing if you cannot attend live. They also have other things like NIHSS certification, unmet needs in hypertension treatment, advancing maternal health, including stroke. It's a valuable platform with lots of resources and education for our volunteers. Lastly, the last thing I would like to talk about is if you are interested in joining the committee, there is on your PhD login, there should be on the account side, there should be a science volunteer portion under your profile, and in that you can self-volunteer for a committee, and you can choose which of the previous committees that I've talked about. You can choose which one you're interested in. Next, I want to talk about kind of the crown jewel of the Stroke Council, which is the International Stroke Conference. This is a annually held conference. It's one of the biggest conferences for stroke in the world, and 52% of our Stroke Council volunteers attend this conference. So for our volunteers, what we have yearly is this ISC membership reception. It's complimentary to our volunteers. It's an opportunity for our volunteers to network and meet with some of our leaders, and also for our early career members to meet with each other. I've included pictures. So the first pictures are some of our stroke early career members, and the second pictures is some of our ISC programming managers and our Stroke Council leaders. There's also a pre-conference, and one of the pre-conferences at ISC is the Nursing Symposium. It happens the day before ISC officially starts, and it's a fantastic way for nurses to acquire contact hours for stroke center certification needs or other nursing education required for licensing. So this year, we'll highlight some of the programming that happened, and notices will go out to everyone soon. And that's it. I'm going to hand off to our colleague, Rebecca.
Thank you, Drew. Just make sure that I have control. Okay, great. All right, good afternoon, everyone. Thank you so much for the opportunity to get to talk to you today about Outpace CBD. I'm Rebecca Licky. I'm the Senior Program Manager for Outpatient Quality Programs, and I'm excited to jump right in here. So at the general overview, the American Heart Association's Outpace CBD suite offers technology solutions and quality improvement support for healthcare organizations as they target cardiovascular disease. So our goal is to connect guideline adoption, evidence-based programming, and systematic approaches to addressing and reducing chronic cardiovascular diseases that are treated in the outpatient space. You can think of us as sort of the preventive wing of our Get With The Guidelines suite. So Outpace is inclusive of programs and initiatives such as Target BP,
check change control cholesterol, and target type 2 diabetes, as well as our product side, which includes an interoperable patient level data registry, ties to funded initiatives, and so much more. But we're here to talk about the programs today specifically. So let's start by walking through those quality programs that fall under the Outpace CVD seat. So Target BP is a national initiative that was created by the American Heart Association and the American Medical Association in response to the high prevalence of uncontrolled blood pressure. Committed to advancing health equity, we support healthcare organizations in communities to improve blood pressure control for the patients that they serve with the latest scientific evidence from the AHA, AMA, and other experts. All of these statistics on the left here are likely no surprise to any of you, but we really do have some work to do as a country to improve blood pressure nationally. Through Target BP, we are deeply committed to combating these chilling statistics and improving population blood pressure control. And we'll walk through exactly how to do that in just a minute. So check change control cholesterol is our next program. The AHA launched this program to help improve identification and management of cholesterol nationally. We know that high cholesterol is a major risk factor for cardiovascular disease and stroke, and that the number of deaths attributable to a high LDL-C is unfortunately going in the wrong direction, nearly 19% increase from 2010 to 2020. So we aim to reduce the number of Americans with adverse cardiovascular outcomes by urging healthcare organizations, providers, and patients to screen and treat this important risk factor, as well as adhering to guideline-directed treatments, including statin therapy. Our last, but certainly not least, our Target Type 2 Diabetes program. We know that cardiovascular disease is the leading cause of death for people with type 2 diabetes, and diabetes itself is a complicated chronic disease with multiple comorbidities. Through the programming of Target Type 2 Diabetes, we focus on both diabetes management and reducing CVD risk factors for patients with diabetes to help people live longer, healthier lives. So how do we do this? Well, our core mission for Outpace CVD programs is translating science into practice. So each year, Outpace CVD engages nearly 1,900 healthcare organizations and positively impacts over 33 million patient lives through its programs and collaboration. Each one of the Outpace CVD programs is grounded in the framework you see here, including QI practice resources and opportunities, regional support and events. We also include patient education, professional education, data tools and registries, and finally, national practice and outcome achievement awards. So keeping this framework in mind, I'm excited to walk through examples of what each of these look like in practice. So, as I dig into these resources that are available, I want to highlight that all of these are free, no-cost resources. And since these are quality improvement programs, I'll start off with some Outpace CVD QI resource examples. So in particular, I wanted to introduce you to an asset series that we intend to expand moving forward. Our Ready, Set, Go resources are designed to be user-friendly, self-guided implementation guides that offer comprehensive step-by-step recommendations to enhance care practices, incorporating embedded resources, links, webinars, and so much more. Our first Ready, Set, Go guide on standardizing lipid management was released in 2024, and we have a brand new resource on standardizing diabetes management for the reduction of cardiovascular disease. Both guides are broken down into Ready, Set, Go sections. So Ready focuses on self-evaluation, has embedded checklists, a model share for peer review, and how to address health equity. Set collates all of the tools needed for integration. So think professional education, treatment algorithms, addressing comorbidities, and team-based care. And then lastly, go, which is putting those policies into practice. So how to leverage technology for implementation, dashboards, shared decision-making, really great prior authorization model shares. Another new quality improvement resource that we have available is through our Target BP Partnered Initiative, and it's a lifestyle policy and procedure template. This is a modifiable Word document that's designed to help create a systematic approach to data collection, assessment, and intervention for modifiable risk factors. This document can be leveraged to bring focus to both primary and secondary prevention. It's a template that can be customized to your organization. You can use it to compare to your current policies and procedures to inform any updates. It's also a way for you to help cultivate champions and invest in staff knowledge and skills. So having systematic approaches like this also help to minimize the impact of staff turnover because you have a consistent starting point. There are also other policy and procedure templates available at targetbp.org. So beyond our resources, the National Outpace CBD team also offers quality improvement opportunities. So the Hypertension Control Accelerator, it's a national quality improvement opportunity that was piloted in 2022 to help support participants of Target BP adopt evidence-based blood pressure improvement activities. So what these do are these accelerators invite organizations to participate in a structured learning opportunity that helps provide education around topics such as implementation of treatment algorithms, team-based care, leveraging EHR alerts, adoption of a blood pressure measurement protocol, and so much more. Each cohort gets to hear from subject matter experts to help align protocols to current guidelines and involves high impact breakout groups for peer learning and model sharing. So following the pilot cohort in 2022, the aggregate blood pressure control of that cohort has increased by 10%, and 100% of the participating organizations saw an improvement in blood pressure control, which is really, really exciting. So in addition, beyond our QI focus, Outpace CBD helps healthcare professionals leverage the broader resources of the American Heart Association to share with your patients, from healthy living resources centered around Life's Essential 8, to more targeted resources by health topic and chronic disease conditions that align specifically with our program. So things like educational infographics on conditions like diabetes and ASCVD, video guides like how to monitor your blood pressure at home, helpful tools on questions that patients can ask their doctors. Sorry, there we go. Okay. Screen flagging on my side, sorry guys. So when needed, our programs and partnered initiatives also create patient resources. So this includes Target BP's suite of self-measured blood pressure patient materials, including what to know before taking your own blood pressure, a recording log, a loaner device agreement, and a guide to using a wrist cuff. In our desire to support equitable health outcomes, these resources are available in 15 language translations. So by participating in Outpace CBD, you will be kept in the loop of our professional resources as well. So for an example, we'd love to highlight our continuing education webinars that are featured as both live and enduring events on the Professional Education Hub. Again, these are all free resources and events. Depending on the topic, these credits are available for a variety of professional types that are listed here. If your outpatient organization diagnoses and manages patients with any of the 3 chronic diseases that I've talked about today, you are eligible to submit data for our programs. After you register your organization, you'll gain access to our data platform. While submitting your data is mostly known for our recognition benefits, which I'll get to in a second, I do want to highlight that the data platform itself is a resource that you could use in your practice. Submitting your aggregate annual data will grant you access to our operational reports, which allow you to benchmark your year-over-year performance in comparison to other organizations in your state, region, or other parameters that you might choose to set up. So, for example, if you're a HRSA funded center, you can identify as an FQHC and compare your performance to other FQHCs. Beyond the measure data, Outpace CVD is investing in additional reports that will allow you to track some evidence-based activities such in Target BP. This will allow you to see your year-over-year improvements in the Target BP pillars and hopefully see how that corresponds to your blood pressure control rates. So, of course, I have to mention that any participating organizations on the call are in great company. We're so grateful to have had nearly 1,900 organizations participate in our Outpace CVD data submission in 2024, and hope to see your organization names on our national recognition in 2025 as well. This includes personalized certificates and promotional toolkits to celebrate your success and national listings on our website, as well as at AHA scientific sessions. If you are interested in submitting your data for a 2025 award, it's not too late, but you will need to act pretty fast as our deadline is tomorrow, May 16th. The first step is to register your organization, which can be done at heart.org/registermyoutpatient.org. And the second step will be to submit your data in our online platform at aha.infosarioregistry.com. Now, that definitely oversimplifies it, but we have many resources available to get in the weeds on these two steps, including a data submission 101, a whole host of resources to get you started on heart.org/outpacecvd platform. That said, the best resource, in my opinion, is always going to be a relationship with your local community impact staff. They will be able to assist you in every step of the process, and of course, with resources above and beyond data submission. So with that, again, I welcome you to visit www.heart.org. And I believe I am passing it now to Jeannie.
Yeah, thank you so much, Rebecca. We are going to take go into some questions now. So if our panel could all come back up on the screen. We have a variety of questions here. I'm going to try to sort them for Debbie. So can a medical assistant get these certifications? I guess the question surrounds, what level of practice certifications?
Thank you. That is a great question. So right now, actually, if you go on to www.heart.org/CPAHA, that will bring up the actual telehealth and telestroke certifications. When you click on each one of those on the first page of each, you will see it is outlined who can be certified or apply for certification. I do not believe that medical assistants are listed for telestroke. However, I would double check that on telehealth, because there are some exceptions as accordingly to the person's job description and what they're doing. So I highly recommend going to those two sites and reading through the eligibility criteria. And then, of course, with further questions, there is also, you can contact the certification team that is also within that link.
Perfect. Thank you, Debbie. Anna, there is a question. Can they register a clinic instead of a hospital for the stroke and heart helper?
Yes, they can. We left it pretty wide open, so yes, they can.
Fantastic. This is also for Anna. They said, I love the stroke support group modules. do you take recommendations for topics?
Yes, we always look, I would be excited to take recommendations. I'm always looking, to get feedback on them. And if there is a specific topic that you're interested in, I would love to hear back from you. So my information was at the beginning of the slide, so I would love an email.
Perfect. Dhruv, you spoke about mentors and mentorship. How can I become involved as a mentor? And I guess on the flip side, how can people obtain a mentor?
So on PhD, there is a tab where there's a mentorship tab. It's a platform where there's a list of potential mentors, and you can navigate through that site. If you have any further questions or need help, you can email me as well. dhruv.patel@heart.org.
And in addition to that question, it sounds like we have people interested in getting involved. Is there specific eligibility criteria for membership, I guess overall AHA membership? And how do they get involved in administrative committees?
So in order to become an AHA member, there are membership dues that are broken out. Basically, there's like dues for early career members, and then there are dues for premium professional, general professional. Once those dues are paid, then you get an opportunity to self volunteer yourself through that science volunteer form on your PhD profile, and you can volunteer yourself to participate on a committee, and then the nominating committee will go through those lists of people who have self volunteered, and they'll nominate people. Another way to get involved is to participate at ISC, come to these events, and then you can potentially network and meet these volunteers who are making these decisions, tell them about your interests, and also you can email them your CV. On PhD, there's an area where there's a committee list, and they have the chairs and chair-elects of those council committees on there, and you can email them your CV along with your interest, and they can potentially get some eyes on you, and you can hopefully participate in the committee in the future.
Great, and I have to add that we're always looking for some wonderful new volunteers. This is for you, Rebecca, but I think you answered this question. It says, hi from Puerto Rico. Do you plan to have a Spanish version of your type 2 diabetes guide?
So great question. If there is an interest, and there almost always is, in the translation of our assets, we always try to translate as many of them as we can into Spanish. So more to come on that. But again, many of our tools and resources we do have available in multiple languages, Spanish, of course, being one of them.
Okay, and I think this is also for you, Rebecca. Are the outpatient nurses and auxiliary staff involved in the outpaced CVD initiative? And if so, how do we get involved?
Yeah, great question. Webinars, when we do like regional or local events, nurses are the primary audience for a lot of the things that we host. And so absolutely, in order to get your healthcare organization, if you are not already involved, would be to go to heart.org/register my outpatient organization for more information on the tools and resources. Anything related to Target BP will be on targetbp.org. If you navigate to tools and resources, you can find a library of all of the resources that we have. We have quite a few. And again, these are all free to use resources and self-service at that point. For the cholesterol and diabetes programs, you'll have to go to heart.org/outpacedcvd for those. But yes, absolutely. We would be happy to have you involved.
There's another question concerning Outpace. Is there a cost to use of the data platform for Outpace CVD? And if so, are there grants available?
So no costs at all. All 3 of our outpatient CBD programs are entirely free to use. So all of our CME events are all completely free. All of the tools and resources, being connected to the data registry, using the data registry. There is no cost to any of the programs whatsoever.
Okay, so we are getting to the top of the hour. I want to, number one, thank our amazing panel for sharing your time, your resources, and your expertise. Thank you to everyone for attending. Once you leave today's webinar, you will receive an email with a short survey, and we would appreciate it if you would complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar, as well as the certificate of attendance. So on behalf of the American Heart and the American Stroke Association and our presenters, I want to thank you for joining us today. Thank you so much for the care and resources you provide to your community. American Stroke Month is our opportunity to really honor the passion and commitment that you all exhibit in the quest to provide optimal care to our patients in prevention and management of stroke. I think on behalf of our presenters, I can also say if there is anything else that you can identify that we as American Heart Association and American Stroke Association employees can do to support your efforts, please communicate it to us. We are willing to hear your input. So thank you for joining us today. Have a great rest of your day. Take care all.
Thanks.